Psychology in Rural Health Careers Night. I'm glad that you all made it. Yeah, so let's get started. By the way, we've also got the Rural Doctors Welfare Association right after, telling you about their initiatives as well. So I guess a good place to start is by asking the question, why rural health? Why focus on rural health? And the answer to that question is the fact that more than 10% of the Australian population lives within outer regional and remote areas. Moreover, we also know that Aboriginal and Torres Strait Islander Australians make up about a third of the population within remote areas. Now, this is significant. This is a significant rise from the 3.9% in urban areas. And the reason that this becomes important is that we know that Indigenous Australians have worse health status than their non-Indigenous counterparts. A good example of this is the 8-year difference in the lifespan of Indigenous Australians versus non-Indigenous Australians, which I'll talk about more in detail later on. We also know that Indigenous Australians have a greater exposure to, the risk factors that lead you to having poorer health, alongside, having been exposed to colonization as well. So we know that to this date, we've got intergenerational trauma that still passes down from generation to generation that, started with colonization. And yeah, so the impacts are pervasive and they still are present today. This is just a graph of what I talked about before. So you can clearly see that there's like an 8-year age gap between Indigenous and non-Indigenous Australians. So Indigenous males live for like 72 years, females for like 75, whereas non-Indigenous males live for like 81 and 83 years respectively. Um, what does it look like? Well, we know that Indigenous Australians have had a 2.3 times higher burden of disease than those non-Indigenous Australians. Now, this is really harmful because that means that they've lost a lot of years of healthy living to disease and premature death relative to their counterparts. Um, Another argument that can be made is that this is really economically disadvantageous as well, right? Because if people are not being productive because of these reasons, then that's not good for the economy either. But that's not the focus of this presentation. Um, I guess um, a somewhat positive thing is that 37% of the disease burden is preventable. So although it is bad, it is horrible that it exists, but we do know that it's preventable, right? Like we can do things to make things better. And we have to address health factors such as substance use, physical inactivity and dietary factors. So from that dot point, I hope you guys can realize that it's not all like physiological. It's not just giving people medicines or like surgeries. There's a lot of stuff that can be done in the holistic domain that I think is the specialty of psychology. And I will talk about the impacts that that can actually have in terms of improving health as well soon enough. But before I go forward, I also want to highlight what I like to call the big list problem, which is the fact that, even though the most amount of preventable work lies in rural areas, that's where you can really make a difference, so to speak. Um, you would think that intuitively you would have more healthcare workers there because that's where the work is at. But we find the opposite to be true. In fact, we know that the number of full-time equivalent healthcare workers in proportion to the total population is lower in remote areas for all healthcare professions, except for pharmacists and GPs. And I guess the photo below is trying to demonstrate the fact that if you have a shortage of these healthcare professionals, then that's going to lead to two things. First and foremost, in urban areas, you might have one practitioner for 5 people, but in rural, you have one for 10. What that's going to lead to is the fact that the practitioner is going to get burnt out, and that way they won't be able to perform optimally, and this can like negatively impact the health of the patients, which is really bad when I and you'll get why when I talk about other factors that lead to um, barriers in terms of accessing healthcare. The other thing is that if you have a shortage of healthcare workers, that's going to lead to like a wait list where people have to wait essentially to get the treatment that they need. And sometimes, um, you can't really afford to wait because health might be declining. So that's another negative factor. Yep. So this graph right here is just meant to show you guys the difference in the prevalence of psychologists per 100,000 people in Australia. And you can clearly see that it's the highest for metropolitan areas, and it dips quite sharply as you go into more rural areas, right? So if you look at like remote communities, basically the workload of a psychologist is three times to that of psychologists in metropolitan areas, right? Because you've got three times more psychologists in those areas. Now, this might look quite bleak, but I just wanted to make you guys know that there are things that can be done to improve the situation. For instance, we know La Trobe University, and there are initiatives by the government as well. And an example of that is the fact that La Trobe University is now offering supervised practice in Bendigo. And that is amazing because it reduces travel barriers and financial barriers for students accessing these services, right? And the reason that I highlight this is because we know that less than 4% of the psychology workforce actually comprises of people who are from a rural background. And I feel like if you increase that by allowing them to pursue their practice, supervised practice in those areas, then you can get psychologists that might better understand the needs of the rural population. Um, so I highlighted the importance of mental of health in rural areas, but you might wonder where does psychology come into this? What role does rural health have? And that's where I'd like to highlight that mental illnesses and substance use disorders are the largest contributor to disease burden in Australia. So they make about a fourth of it, a quarter of it, right? And the other thing is, by addressing these mental illnesses and substance use disorders, you're actually making a bigger impact than that quarter because interventions that target mental health also target other conditions, such as cancer and cardiovascular diseases. Now, these have their own burden of diseases as well. And that's done via secondary mechanisms. So, for example, if you're targeting someone's smoking behavior, that's also going to impact their prevalence of lung cancer, and that's going to reduce the burden there as well on the healthcare system. And if you're targeting their diet, then that can maybe a low sodium diet can reduce cardiovascular diseases. So that's kind of how it might reduce that as well. Now you might wonder, okay, rural health is important. I know psychology can make the biggest difference in terms of the burden of disease, but what does it actually look like for someone to work rurally on a day-to-day basis? And that's where I'd like to show you the fact that predominantly half of the people who have just graduated are going to be working in the rural areas within the first 5 years. So imagine that all of you people in this room were to, become psychologists, then half of you guys are going to be working rurally. Um, so I think that image really helps. Other than that, I also want to highlight that you're probably going to be working in the not-for-profit sector or in community hospitals or in the school sector. So that blue line corresponds to remote areas, remote psychologists. Um, and I also want to highlight that there's a lack of independent private practice, right? So if you look at independent private practice, that column has got literally like no representation for remote areas, meaning that it's not really prevalent there. Right now, this is an example of the kind of jobs that are available, right? So I want to show you how you can actually like score a job. These are the government websites available for all the different states. Now, given the fact that that you're not going to have private practices and you're going to be working for the government via education or something like that, so I think this is really important. And if you look at the image, that's the South Australian website. All you got to do is search for, your title, which is psychologist. And if you're working rurally, in this section here, you put the postcode of that rural area. And I think that this is really helpful, even if you're not like going to be working rurally, because it gives you an idea of the job prospects that are available to you. You know what kind of requirements they may have. For instance, if you're a child psychologist, you might need to working with children checks, stuff like that, and that can be really helpful to know. We also have not-for-profits. Some of these are listed below. Like we've got the Rural Doctors Network. We've even got the, I think, Rural Doctors Foundation, the Center for Rural and Remote Mental Health, etc. And I highly recommend you guys to check out their membership because it's free of charge, and also subscribe to the newsletter because that way you get to know about any like interventions or what's new in terms of the rural health domain. And other than that, you also get to, you know, know about job opportunities that these organizations may have available. Now, when working with Indigenous Australians, I think it's really important to think about these things. Firstly, you need to abide by the nine guiding principles and of for the um, upkeep of their social and emotional well-being. This is actually going to be taught to you guys in your second year lectures. Um, so I think that I won't talk much about it right now, but you can look at that paper if you want to yourself. One thing that I do want to hammer home is the fact that you want to ensure that your session is client-led. And the reason I say that is because, you know, your client is coming from a different culture, and so they're going to have a different way of life. They're going to have different is like experiences and norms. And so you really need to let them guide the session. You need to let them express their narrative without you kind of letting your assumptions of what it might look like interfere with that. And that is something that's really important because that has happened in the past, and you may not necessarily need to know that you're doing it for you to be doing it. Uh, And another good way to actually maintain a client-led session is via hiring cultural advisors. So they're usually from the community, and they're really helpful in terms of making sure that the intervention is culturally safe and appropriate because they're aware of the social norms and how the community operates. Moreover, they're also helpful because, a lot of these clients, they've had negative experiences with, doctors in the past. So they might not be as trusting of you as you'd like them to be, right? And I think a cultural advisor kind of eases their nerves and lets them be more comfortable in that environment. Culture bound syndromes, that's the third dot point. That's another important one because sometimes in certain cultures, you can have certain behaviors that are completely normal, but when you come from a different culture, you might see them as atypical or pathological. A good example of this is sorry cutting. So we know that in some indigenous cultures, um, there's a practice called story cutting where they make certain cuts to their bodies in order to display their grief for the ones that have passed away. And as a psychologist, you might, from a Western background, you might think that that's that might look like abnormal to you, but that's actually completely normal. And in fact, if you were to, it's a normal way of expressing grief. And if you weren't to take part into that, then that's kind of actually concerning within communities. So that shows you how different culture can be and how it actually influences the way you see things. And it's important to, not blindly come into it with your own opinions and actually have some space to account for the reality of things, the differences that might exist. And so, that's all good. I've talked about all the theory, but I feel like to actually connect the dots, you have to consider the experiences of working as a psychologist with Aboriginal peoples. And a good example of that is Dr. Taylor, especially because she graduated from the university. She's a child psychologist, and she's also an academic co lead for making First Nations content and ensuring engagement within the School of Psychology. So I think she's the perfect example. Other than that, she's actually worked in Alice Springs and as well. And after working in Alice Springs, she worked within the Pichinjara and Yankunytjatjara communities, respectively. And she's also developed an allied health service for young children living in Alice Springs, which I'm going to talk about later. Okay, so what did it look like for her on a day-to-day basis? Well, she's a fly-in, fly-out psychologist, so she had to take planes. It could get crowded sometimes. There's a lot of dirt roads in rural areas, so that can kind of act as a transportation barrier, not only for the clinicians themselves, but also for people who are living rurally, right? It can act as a barrier to things like employment. It can act as a barrier to accessing health services, which is devastating given the fact that the prevalence of health professionals is lower within these areas to start with. Um, and the prevalence of, health diseases is often higher for rural population for most conditions. So yeah, you're going to be living in motels. And as I said before, you need to have that support from interpreters, those cultural advisors that not only are they going to advise you about certain behaviors and what's considered appropriate, they're also going to be present within that session and help kind of maintain rapport and help the client feel safe. And, if they don't speak English, that can also kind of help you understand what they're saying better. And yeah, that kind of relates to the point of understanding cultural norms. So that's the whole point of a cultural advisor. But, other than that, a lot of people, and I think Dr. Taylor herself, actually consulted the community as well with regards to what they want, what their practices are like. You have to actually not indulge, but like make yourself a part of the community yourself. You have to engage in their practices to really get to know their way of life so that you can better understand their needs and cater to them. Yep, and you have to focus on building relationships. That's especially important because, as I said before, they've had negative impacts with, healthcare professionals, and that kind of makes them vary. So you have to try and build relationships in order to have that therapeutic effect in your practice. And I guess having a cultural advisor can also facilitate that. Um, Another way of doing that is actually via self-disclosure. So I find this one interesting personally because usually you would think that, self-disclosure is something that's not to be done in psychology practice. However, the more you do it, if you work rurally, you have to kind of like figure out that in order to build that trust, you have to do it. For example, I guess, if you're talking to someone who's from an indigenous background, you might want to share your experiences as a mother, and that can kind of like help you bond with them, right? You also need to be like extremely flexible in your work. So, because there's a shortage of healthcare professionals, if you're working there, you're going to be called upon when there is a need. So if someone, you might be like, it might be like 11 p.m. on a Saturday, and you could be called upon because someone needs help. Just give me 1 second. Sorry, can I help you? Yeah, that's really fine. Yeah, that's really fine. No, that's really fine. Don't worry about it. That's really good. Yeah, sorry about that. Yes, yeah, that's good. Okay, so what does life in remote communities look like? This is a quick snapshot. So, a connection to culture and land is an important aspect of most of indigenous cultures. And this is really important for me to mention because there have been cases in the past where people have been diagnosed with depression. And that's not necessarily because they're suffering from depression, but more because, they've migrated to urban areas and they've lost that connection to land. And their symptoms might look like depression. And I guess the separation is in the fact that it's not really an irrational experience. It's not an irrational expression. It's more like an appropriate way of expressing grief to something bad that has actually happened externally to them. Yeah, strong communities. You can see like there are so many different communities um, amongst Indigenous Australians. So there's a lot of diversity as well, which I'll touch upon later on. As I said before, there's dirt roads, so difficulty accessing opportunities and supports like healthcare, and that's a barrier not only for you but for people living rurally as well, right? And lastly, and I think this is really devastating because meeting basic needs is so costly. If you look at that photo, a bag of grapes at Coles costs me around like $4.50. If I live rurally, that same bag is going to cost me $12.30. So you can only imagine, given the fact that rural populations are usually socioeconomically disadvantaged. They don't even have access to healthcare as good as we do. Combined with the fact that living expenses are more expensive for them, you can understand why that would make lead to the health gap and lead to worse health outcomes for them. And that kind of like we go full circle here, right? Because if you can't afford this food, like healthy food, because it's so expensive, you might you know, would eat food that's not so healthy, and that can kind of lead to physical health conditions as well, right? So I guess you can kind of see the cycle in it, in a way. Now I'm going to touch upon the work done by Dr. Amanda Taylor in Alice Springs. So most of the services where she worked were Aboriginal controlled and led services. So basically, you might be working for a service, but it's the head of that, like who allocates resources and decides what to focus on, might be an Aboriginal person, and I guess that helps because they can tell you about what to focus on, what to target, and that's really good, right? Because it kind of helps you figure out the needs of the community. Oh yeah, community complexities. This is another shocking one. So if you look at the map to your right, right, you see that there's a lot of different um, Aboriginal community mobs, and Alice Springs is kind of a hub for them. So all of them kind of combine into Alice Springs if you look at their territories, right? So what that leads to is the fact that at one season you might have 30, not 30, 40,000 people in Alice Springs, but like the next season that might increase to 71,000. Now, you know, that's a huge rise in the number. And if you want to cater to those needs, you have to plan for that. Because if you don't, then there's going to be a huge shortage in terms of the number of people that you're going to have servicing to the needs of the population. And yep, socioeconomic disparity, as I mentioned before, you know, living is expensive. You can't access opportunities because of those barriers. You're more exposed to like factors that lead to um, ill health. So makes sense. Um, Impact of the Northern Territory intervention. So basically, in 2008, there was an article that was released that really kind of portrayed Aboriginal Australians in a really negative manner with regards to like substance use, and that led to like a lot of like bad media surrounding it, and a lot of stigma and victim blaming with regards to them. And when Dr. Taylor went to Alice Springs, this happened in 2008, and when she went there 7 years later, that was really still in the minds of people living there. So you can kind of see how big of an impact things like these can actually have within the mental health of Indigenous Australians. Um, yeah, and there's a lot of diversity amongst communities, right? So if you look at the map again, you can see there's a lot of different communities that actually go to Alice Springs. Not all of them are going to be the same, right? Like just because a person is indigenous doesn't really make them homogenous. Like you might have one indigenous client from the Yunkunjara community and one from the Pitjantjara community, and they're going to be two completely different people with regards to their language, their upbringing, their traditional practices, and you can't really make any assumptions because that can have really negative impacts. Right, so that's all good. I talked about what it looks like to work rurally, the experiences of Dr. Taylor. Um, but what's a like I talked about it a bit in a broad manner, but like what's a solid example of an adaptation, right? Like what does that look like? And that's kind of what I'm going to talk about right now. Now we know that Dr. Taylor was a child psychologist, and so she did a lot of child-centered play therapy. And when she tried to administer this therapy to rural Indigenous Australians, it didn't really work well with them. And a good reason for that is that there's differences in upbringing. So if you look at the picture to your right, that's the no, to your left, that's the base fourth edition like kit for administering the therapy, and that's not really reflective of what an upbringing for an Aboriginal child might look like because they engage more in like outdoor play and they're more independent and they might not have encountered like some of these toys. The other thing is if you're like doing assessment on them, they're at a disadvantage because due to language barriers, English might not be their first language. So if you were to test them based on a language that they're not that familiar with, of course they're not going to perform as well. And this is even more devastating when you consider the fact that research in the past has actually done research like assessment like this and come to conclusions that are really um like harmful to the community. Actually, I'll go back. So a way that Dr. Taylor actually adapted is by, I guess, as I said before, like helping children engage in more outdoor settings when performing the therapy. And also, if you're assessing people on these tests, you have to, translate them to the language. The other thing that you need to account for is the fact that a lot of the evidence base for these tests is arrived at via focusing on weird populations. So populations that are westernized, Western, industrialized, educated, rich, and democratic. And fun fact, 80% of the participants in social psychology studies are actually first year psychology students, right? From like first world countries. So that's not really representative of the rest of the population. And if a test has been standardized to that population, it's not going to work for other cultures. I guess actually another example that I could bring up is the fact that there has been a lot of misdiagnosis amongst Indigenous Australians when it comes to ADHD. And the reason for that is that a lot of upbringing in Indigenous Australians might be a bit more like independent, like parents let their child, you know, be more independent and explore the environment on their own. And because of that, when they enter like a Western education system, they might find it hard to like sit at one place and, focus. And, you know, that doesn't necessarily mean that they have ADHD or that has like a difference in their abilities. It's just that they've been raised in a different environment, so they're just not used to sitting down at one place. And you kind of have to adapt that in terms of a school environment and also in the way you administer therapy. But yeah, that's all I had. I would also like to talk about the other events that we've got happening at the university's Rural Health Alliance. A good one of them is the Teddy Bear Hospital visit. So applications are closing on the 26th of March today. But you guys are at an advantage because I know that we don't have as many psychology applicants as we usually do for stuff like medicine and dentistry or nursing. So you have a really good shot of getting in. And that's only for trip one happening in May. I think you still like we have another application for the one happening in September, so you still have a chance. You can also look at the Kidney Health Festival. I think they're both great opportunities. I think they're all expense paid, and you get to like go to rural high schools and you get to like educate children about mental health. You might have a station focused on mental health where you could perhaps tell children about how your body changes when you're feeling anxious. You might sweat or your heart rate might increase or you might be feeling like you might be breathing short. So all sorts of things. And then you can teach them some breathing exercises to calm them down. So like stuff like that. I think that's really helpful for your resume and looks really good when you apply for masters as well. But yeah, thank you. That's all I had for today. Um yeah. Um, I've also got the QR code for the Adelaide University Rural Health Alliance's like information page. You can access their socials and get to know more about their initiatives as well. But yeah, now I've also got the RDWA that are going to tell you guys about their initiatives. But yeah, that's all from my end. These are some of my references. Thank you.